It's 1:30 p.m. So a couple hours went by and my anesthesia is like wearing off, so the pain is a lot more than my previous video. I've started my next round of painkillers, the hydrocodone with acetaminophen. This is definitely a lot less strong than the codeine they let me have before I left the hospital. Overall today, like so far, my pain like around like this area, the swelling seemed to have like gone up, or maybe like my anesthesia is just sort of wearing off, so just feeling a lot more pain today. I'm pretty sure that is just going to be that way for 3 days, which is the worst of it. My voice right now is a lot more weak than before. My sore throat is still here. The cough and the minor coughs that I have slowed down a little. And previously, my voice was just so weak that I'll just randomly cough. Now it's like a little bit more hoarse, but I'm not worried. Just trying to get some food in my system since I didn't have any food yesterday. Just eating soups and stuff that's really, really soft. So I guess this is my voice at 1:30. Alright, check in with you guys later. Hello friends. Just want to give you guys a live update. Today is day 3 and I'm done with the last of my prescribed Vicodin pills. I didn't really vlog earlier because I wasn't feeling too great. So after our initial anesthesia wore off, I just had a lot of sore throat and kind of like phlegm in your throat kind of feeling when you were coughing and talking. And the pain was a lot more noticeable because the painkillers were a lot more weak that they prescribed for after the initial Oxycontin. So I could really feel my arms here being extremely stiff, and I was supposed to take the medications every 6 hours, but I always felt that the pain came back a little bit earlier than 6 hours. So from 1 a.m. to 7 a.m. it was kind of difficult to sleep the first 2 nights. I kind of needed to sleep in an upright position, so I basically slept on the couch with like both my arms propped up on top of a pillow. That kind of helps my body be in a more relaxed and normal position. I didn't feel like I could lay down on a bed, mainly because I couldn't get myself up. Like this area here was very weak and I couldn't like push up. So that felt really strange. And my neck and my head had like limited mobility, so I felt like I couldn't like turn my head this way. Actually on the second day, I was trying to practice the exercises that my doctor suggested me to do, which is like rotate your head, stretching out your neck from left to right, and also lifting my arm up above 90-degree angle by walking my hands up the wall and trying to stretch it out. In the beginning, those really hurt, but the more I did them, the better I felt. So day 3 now, I feel like the mobility and the fluidity of my arms have come back, meaning like it's a lot more easy for me to lift my arms up and down. And I did get a lot of finger and feet numbness, which is a symptom of like low calcium for after you remove your thyroid. So I've taken some calcium vitamins, and that's helped a lot. Overall, I think my recovery is great. I am, like feeling better every single day. And the more I practice my exercises, the better it gets. Also, today was the third day, which meant I was able to remove my initial bandage and look at my scar and be able to like take a shower. I know I was banned from like taking a shower after surgery, and that was just so uncomfortable. My skin started like feeling really itchy with the bandage on it. So after taking a really long shower, I just feel so much better now. I was really scared of looking at my scar. Looking at it at a glance, it's not too bad. It looks like a vertical scar from my armpit, and my entire armpit is entirely bruised. It's like black at this moment. So, and then the area here has a lot of like the residual gas that they used in the robotic surgery to pump my body up. So that area is very swollen and inflamed. So the bandage is really tight to help kind of keep the swelling down or try to push out the gas. Overall, all of that is very tolerable. As of right now, I've taken my last pill. Hopefully, after this, while I'm taking regular Tylenol, my pain will be okay. My voice, as you can tell, has gotten more strong. Like I feel like I have a lot more energy and air coming out of it, even though it is a little bit raspy and sometimes not so clear. I do feel like the air and the strength is coming back. So that's my check-in. Thank you.
Hello, it is 8:30 on day 6 update. So overall, I feel like I'm recovering pretty quick, and my recovery is faster than I expected. As you can tell, my voice is back and a lot more strong than the first time I came back. I feel like my strength in my voice has come back by a lot. I do get sore throat and throat aches once in a while, but usually I just try to keep my throat extremely hydrated. I'm drinking lots of tea and water, and I haven't gotten the phlegm-like cough that I was getting in the first few days. I think when I first came back, like my throat, when I was trying to make that video, I had to stop the video 3 times to cough. And the cough was kind of like a gagging kind of feeling where you feel like there was something in your throat that you needed to cough up. But I think that is from the residual feeling of having a breathing tube down your throat when you're under. So all of that scratchiness and like ache in your throat has kind of gone away, and I'm feeling really lucky that my vocal cords weren't damaged or anything like that. That I was able to like regain my voice so quickly. What I'm still thinking is I was going to like milk the fact that I'm not able to talk at work and want people to stop volunteering me to give presentations, because apparently everyone wants me to give presentations and talk. I hope they don't find this video and figure out that I'm actually totally well and I'm just pretending. Also, I did tell my manager that I have a secret YouTube account, and he told me he reminded me not to tell everybody the good things about him. That was really like hilarious. And not tell everybody where I work too, so that I don't get any hate. That was actually really funny too. I'm like, no, my YouTube's not about work. But I'm making it about work now. All right, anyway. And I just said I don't golf. I've cut out all drinks in general. Like, I've only drink water and tea. Not even black tea, no caffeine at all, no coffee of any kind. And the two teas that I'm drinking a lot is actually this two. So this brand is the brand that I featured about the cough drops. And I'm drinking this called Gas Relief. And basically it's a combination of chamomile and mint with a bunch of other like caraway, coriander, like herbs, and lemon balm. I think this helps a lot in terms of like trying to get rid of gas and bloating, especially like the gas that's trapped in my upper body and my stomach. This helped a lot. Also, if I'm tired of this and I feel like I'm drinking too much of this, I just go and drink buttermints, which I think is like the cheap whatever tea that you can get, but I just like this flavor. It's just regular peppermint tea, but it has like a hint of vanilla, so it's kind of nice, but there's really nothing to it. To make this more potent, what I do is I cut an inch of raw ginger, I cut it up, and I put it in here with this tea over hot water, and I try to drink that. I think that also alleviates any kind of nausea or stomach problems. And tell me about it. I know everything about like how to de-bloat because of my adenomyosis symptoms. Okay, so back to the recovery stuff. Obviously you can tell I am wearing this bandage thing, and I'm wearing this pajama shirt, which is a button down. I was not able to like raise my arm up above 90 degrees when I came home, so I couldn't put on any shirt that required me to like raise my arm up. So all I did was live in like these button down or zip up type shirts. Well, I actually didn't have a lot. They were all my pajamas, like pajama tops. And I think because the pajama tops were so loose, they were very comfortable in order to like slip on and off. And the doctor originally suggested that I get like a halter top bra like thing to compress down my upper body because there's gas kind of trapped in my shoulder area here. But problem was I couldn't put it on. Like, tried to put on a bra, but it hurts so much like to raise my arm up, so I gave up on that. And then also there were compression shirts that I tried, like regular ones, that I still couldn't put my arm through. Like, if I put my arms through, I couldn't pull it over my head and then get it over this area here. So all in all, what ended up happening was we decided to just get these ACE bandages, which are the same ones that they used, similar ones they use in the hospital. The only difference is that when I came home from the hospital, they had this machine, I don't know what it is, but they were able to clip or fasten the bandages together with this type of staple machine that put the metal around it, so they secured it super well. So they like made like this halter bra top and then like made a sling. The bandages on this, like these little clips, they're not super secure. They don't hold super well, so I would suggest you buying 2 of them and use like 6 clips for 1 bandage, because it's kind of difficult to like wrap it. In terms of the wrapping, it did help a lot to squeeze out the excess air from my skin. And yeah, overall it just felt better and better every day. And I would say like most of my pain, I would say more than 90% have disappeared. I don't feel them anymore. And I'm like celebrating little wins every single day. Like yesterday I was able to take a shower with me being able to like hold my hand up and touch my other hand, like shoulder here. Before I couldn't do that. Before my hand was like kind of like thus, like on my side, kind of like resting area, a 90-degree angle or lower. I couldn't like raise it up, and I obviously couldn't do this. I can't do that either. Like forget about it if I even try to like raise it up above my shoulder. So like grabbing the shower thing was like not super easy. And the other thing was like seeing my scar for the first time. I was really freaked out. I saw it twice. Obviously on the third day I had to like take my bandage off and like take a look to see if everything's going well, not infected. I was so scared to look at it, and then it hurt when you remove the bandage. And you know, the scar is not what I expected. It's a lot larger than I originally thought. It is one really long line, about like 4 inches long, and my armpit is all like bruised and black, so that like shocked me at first. I was like, oh my god, what is happening? And then my shoulder has all these like you know, bruise colors, and also like leftover adhesive tape. I don't know what they did to like glue my arm down. I don't know what. But it has like, you know, the bruising was more prominent throughout my neck, but it's not there anymore. Completely gone on day 6. And the way that I would describe the scar is like almost like 4 inches long. And originally I thought it was gonna be a lot more hidden, like it was gonna be right underneath my armpit, but it's not the case. It's actually pretty visible. It is like almost like in the front of my armpit, like here. So if I were resting my arms, it would probably look like a shadow when it heals. But if you open like that, obviously you can see it. It's not actually right underneath, like it's not that hidden, because it was a little bit towards the front as they went diagonally, so it's there. And what also scares me, or like the way I'm gonna describe what it looks like, brace yourselves. I know a lot of people on YouTube, they would post a foot picture, but I will not do that, because when I saw other people's pictures, I did not like them, and I was not happy to see them. I guess I was grossed out by them until they fully heal. I don't really like to see like these like grotesque pictures, but here's how I'm gonna explain it. I'm gonna put a picture here. Okay, it really looks like the Peking duck that I make for holidays. And when you're baking a Peking duck, you would stuff the body with a bunch of sauces, and you would use a toothpick to close up its cavity, and you would thread that back and forth through its skin. And here's a picture. And when you do that, your skin is like this. And also when you're making a Peking duck, you also blow air into the skin to make it puff up, to make it crispy. That's how I feel like my arm is. It's a Peking duck. Like it got blown up. There's no bruise. It just very like puffy. And your skin is very elastic, so like it'll like bounce right back down. But that's how it feels. It feels numb and weird feeling when you're touching your own skin and you know there's air inside, and when you press down it like kind of hurts. and it just goes away. It takes time to like work itself out of your body. I know that's gonna be like the problem for any robotic assisted surgeries. They pump air, CO2 in your body to blow it up so they can see better. But yes, that's my scar. I did read some information about scar care, like you should put Moderna cream or scar creams on it, but as of right now, not putting anything on it at all. It has not been 2 weeks. As for the follow-up, I have a 2-week not vacation. I said vacation. I feel like I'm on vacation right now because I have not done anything, and every single day there's nothing going on. When I take my medicines, or all my medicines, I just got so tired and exhausted. All I'm doing is like taking naps and just chilling and trying to listen to audiobooks, because even watching TV makes me really tired and hard to concentrate. So I'm just really resting a lot, and I think that helping me like get better a lot faster. But yeah, I'm not doing too much, and I feel like it's kind of chill and nice because I'm just on vacation. Yes, so back to what's next. What is next is there's going to be a pathology report follow-up, and that's going to determine if I need further treatment. That's going to be a look on what they extracted, if the cancer was encapsulated or not, if I need to do further action like radioactive iodine treatment to kill my cancerous cells, or I'm good to go for now. And then in 4 weeks time, I have a blood check with an endocrinologist, which is going to test my hormone levels from my the left side to the right, to see if I need supplemental hormone therapy, which I probably do need. Yeah, I mean, hopefully I won't need so many pills, but we'll see in the 4 weeks checkup to see what is the cadence. And also I know there's going to be a test every 6 months and checkups to make sure that cancer has not reemerged for foreseeable future, and that, you know, in the future, if it does reemerge, you would either undergo medical treatment or go under another surgery for your thyroid, whatever the case may be. So I think that overall my recovery has been really, really great for the thyroid. Other than that, currently I'm still kind of struggling with my pains, pelvic pains for adenomyosis. So during my week of surgery, I did take some tranexamic acid that helps to stop my period, I was supposed, during the surgery, and I'm so happy and glad that worked well, because I had a big discussion with my doctor as she was trying to put me on Lupron, which is this shot that would induce menopause for the next 3 months to get me through surgery, but I ultimately refused at the last minute, and I ended up was able to avoid that. So I'm actually glad that didn't happen during the surgery. But right now I am managing my pelvic pain with that. So I think that is causing me to be really exhausted every day. And I'm on the road to recovery, but today I was, forced myself to go downstairs for 10 minutes on the treadmill to just get my body moving. And I'm hopefully I'm just feeling better every day. As opposed to the adenomyosis and this surgery, I have a consult coming up in early May to talk about those. And I'll have a separate video, separate separate time to talk about, you know, what were my issues on that and like why that was such a big deal. Well, just to make it easy, I mean, to make it short right now, is just that, you know, I've had pains most of the month and it's crippling, and I just take a lot of painkillers at this moment. So I try to just stay home, relax, drink my lot of tea. I use my heating pad. Like, I do everything possible to kind of get over the episodes. But yeah, like, everything's going super well on that end. Hopefully, you know, I'm still gonna continue to chill.